Does stem cell therapy really work for COPD? The honest answer is sometimes, but it depends on several key factors. Whenever we have damaged tissue in the body that we can't overcome or that degrades over time and gets progressively worse, there's a multitude of factors that create that, right? So what we want to do, or what we should attempt to do, is to manage some of those contributing factors, obviously, but then more importantly, provide a healing resource to the best of our ability to where the damage is. When it comes to a joint, we take healing elements, we package them in abundance, we deliver them to damaged tissue. The question with COPD is, how do we get regenerative components to that area? Now, there are a wide variety of studies that have been done using various resources, right? So stem cells from various places, done in both animal models, done in both actual human beings, and then a wide variety of other components, right? So things like exosomes, things like PRP injected in various ways. And what we can gather from some of that evidence is there are some tools and resources that do provide benefit. But I think to some degree, when it comes to COPD, again, we go back to the holistic approach, right? So first and foremost, why do we develop COPD? The most common cause is some type of environmental irritant. If it's fumes or something from our workplace, we have to get ourselves out of that environment. If it's smoking, we absolutely have to quit smoking. If we're around secondhand smoke, we absolutely have to get out of that environment because we don't want to continue to damage tissue over time. Now, once the tissue is damaged, it's unfortunate, but lung tissue tends to degrade from that point, or it's progressive typically. And in many cases, a patient could have quit smoking 10 years prior and still develop COPD as they age. So what we want to do is we want to take into account all of the circumstances that have created the condition, and then more importantly, continue to contribute to it. Right? So if somebody's eating a lot of processed food, a lot of sugar, they're highly inflamed, they're going to experience symptoms at a much higher rate. So it's not always just about providing resources to heal tissue, but it's also about managing the environment and doing the best we can to keep it from progressing. But more importantly, improving their ability to breathe better predominantly and function at a much higher rate than they do currently. An integrative approach is essential for a condition like COPD. It's about managing the internal environment. We want to eliminate things that promote inflammation, right? That's important because whenever there's chronic inflammation, it's going to decrease function in damaged tissues specifically. Obviously, when we're dealing with lungs, it's pretty important, especially for COPD patients. Now, there are a wide variety of tools and resources that are synergistic in a regenerative environment. Yes, the goal is to heal, but we also want to stimulate the body to heal in general. There are many things that can be utilized for that. Exosomes have been used widely, as well as some peptides that may play a role in the healing process. But at the end of the day, really just managing the environment, setting the patient up to heal appropriately, and then using resources that have been proven to provide us with a good positive outcome in that particular target tissue, and then delivering it to that target tissue effectively. I think all of those things combined, we can see a pretty significant change in symptomatology, with the understanding that, COPD is not a curable disease. We never want to, promote the idea that, any of that can be cured, but it can be dramatically improved as a result of taking a holistic approach to solving problems. Follow-up is an important part of any treatment methodology that we use, whether it's for, chronic knee or if it's for something different. We want to do routine testing. We want to make sure that the patient is improving. We want to do objective outcome questionnaires for that particular individual and know for sure that what we're providing is actually working and moving them in a direction. Secondary to that is we want to make sure that they're not having any difficulty with anything. We want to be able to monitor them to see if there's any, type of reaction to any of the things that we're doing, whether that be dietary or, interventional. So I think follow-up is an important piece of the puzzle for every condition, regardless of what we do. Obviously, when we have damage to our body, if we can repair that damage, then we're going to see a better long-term outcome than if we just manage symptoms and allow things to get worse. Regenerative medicine across the board for a wide variety of conditions, including lung conditions, as well as the heart, as well as the kidney. There are many different applications that are going to come down the pipe in terms of regenerative therapies. Currently, as it sits today, there are very specific mechanisms that we can control. Right? So the overall inflammatory process in the body, immune regulation, there's many things that can be affected utilizing regenerative tools. There's a lot of benefit to that, especially because many of those things contribute to the condition itself. If you're researching stem cell therapy for COPD, start by asking the right questions. Leave your comments below. I'm here to help guide you toward credible information and realistic expectations.